The health of humans and animals is vitally interlinked. A majority of emerging and endemic human diseases have their origins in animals, be they be transmitted directly or through food or the environment. Some 60% of emerging infectious diseases that are reported globally come from animals, both wild and domestic. And over 30 new human pathogens have been detected in the last 3 decades, 75% of which have originated in animals. So One Health is therefore a collaborative, multi-sectoral, transdisciplinary approach working at local, regional, and national levels with the goal of achieving optimal health outcomes, recognizing the interconnection between humans, animals, and our shared environment.
Stakeholders from health, agriculture, and the environment gathered for the launch of PAHO's One Health program that seeks to achieve a comprehensive look at the health of the country, not only from a human perspective, but also from the point of view of animal health and the environment and how they are all interconnected.
The focus has to be on that area where everything we do as humans can also have effects in our environment, or what we do on the environment can also have effect on our human health. What we do with our animals can also have effect the human and the environment. So it encompasses all three in one. And so we want to be able to communicate with each other and share information with each other, because there are times, for example, if there's a disease born, a zoonotic disease that affects, and then you see later on it can affect human, it transmits to human, then the Ministry of Health comes in, BAHA has to come in, the environment comes in, because then all of these things have they intertwine with each other. And so for me, it's just for us to highlight where Belize is, and Dr. Jack rightly mentioned that Belize has been one of the only countries, or few of the countries, that have been able to really put this forward as well at an early stage.
This collaborative effort between all these stakeholders to protect people, animals, and the environment has been happening for years and was experienced with the recent avian influenza that had contaminated several farms in Orange Walk. Agriculture Minister Jose Abelardo Mai says that the platform is about preparedness and response to health threats in all three sectors.
It's about response and increased surveillance capabilities to address, from an agriculture perspective and human health, zoonotic diseases and other other health threats at the human, animal, and environment interface, including plants. From an agriculture perspective, increasing surveillance of infectious diseases and other threats that affect the human, animal, and environment in the country of Belize is of critical importance to us.
The data collected on the platform will help to inform not only policymakers in Belize, but is not limited by borders and will allow for networking with other countries on best practices.
What the One Health platform will do is we'll share data. There's be a database where all three ministries that it will communicate with, and we will be able to share information of what is affecting our region, but at the same time, not our country, but at the same time share information that what is happening in the region, that what Belize is doing, and as well we can get from what they are doing to see that there are these things that does not affect Belize as well.
Duane, Moody for News 5.